The public health crisis may have subsided, but the information war hasn't. We are facing a persistent threat where false claims and outdated myths threaten to undermine genuine medical progress. Four things stand out: defining the misinformation threat, social media's amplifying role, common misconceptions explained, and building resilience and trust. Here's the first piece: defining the misinformation threat. At its core, misinformation isn't just fake news, it refers to false or misleading health information, and crucially, it includes those half-truths and unverified claims designed to obscure solid medical evidence. Understanding this distinction is key because the threat is much harder to track than simple falsehoods. And this problem hasn't stayed confined to the pandemic. The scope has expanded dramatically, moving well beyond just COVID-19. We are seeing misinformation pop up everywhere, from vaccine safety and mental health practices right through to chronic disease management. But why is this so pervasive? Because these claims frequently exploit genuine gaps in public understanding. They confuse correlation with causation, they downplay the role of rigorous clinical trials, and they make it incredibly difficult for people to distinguish credible information from deceptive narratives. And the impact isn't limited to individual symptoms or treatments. The consequences are systemic, meaning misinformation doesn't just harm people, it actively erodes public trust in medical experts and undermines public health policies themselves. Next, social media's amplifying role. The rise of social media as a primary source for health updates completely altered the landscape of public health communication. When people started relying on digital platforms for real-time guidance, they bypassed traditional gatekeepers, the established experts and government agencies who usually provide that information. But it's not just about what you see, it's about how the platforms are designed. The algorithms prioritize engagement metrics, meaning they favor content that generates a strong emotional response, whether that emotion is fear or outrage. This dynamic means sensational or polarizing claims get amplified, often overshadowing factual information. What's surprising is how this system interacts with human behavior. We have confirmation bias. We are naturally inclined to engage with information that confirms our existing beliefs. This tendency means that instead of challenging false claims, we reinforce them within echo chambers, allowing misinformation to flourish. Then, common misconceptions explained. One of the most enduring myths is the claim that vaccines cause autism. This misconception actually originated from a single older study back in 1998, a study which has since been debunked and even retracted due to fraudulent data. The global consensus among major health organizations confirms there is no link between vaccines and autism. It's also common to believe that herbal remedies can replace conventional treatments entirely. While some natural substances certainly have therapeutic properties, their efficacy is often inconsistent or unproven. This means we must be careful not to let the perceived safety of these alternatives overshadow the need for rigorous scientific validation. Another widespread misconception is the idea of detox diets. These diets often promote the notion that our bodies accumulate toxins requiring special cleanses, but scientifically speaking, this concept lacks basis because your body's natural systems, like the liver and kidneys, are already highly effective at doing that work. Finally, we often assume that stress directly causes major diseases. While prolonged stress certainly contributes to existing issues, it can worsen hypertension or weaken your immune system. Scientific evidence shows it doesn't act as the sole initiator of disease progression. And then, building resilience and trust. So, how do we actually fight this? This solution isn't just one thing. It requires a massive collaboration among governments, tech companies, and the public itself. Governments need to set clear policies and standards, but that only works if the platforms are also doing their part. And what's surprising is that the burden doesn't fall on any single group, it needs everyone working together. This brings us to the individual level. It's not enough just to know facts, we need media literacy. We have to understand how information is constructed, and that means equipping the public with critical thinking skills, the ability to discern credible sources from misleading narratives. And finally, we have to talk about trust itself. For any of these efforts to succeed, the institutions, the scientists, the CDC, who must be transparent about their methods and data. This openness is crucial because without it, public confidence simply erodes, making all other interventions meaningless. To recap, misinformation has broadened its scope significantly, moving far beyond just pandemic-related topics into daily life. Social media platforms bypass traditional experts by using algorithms that prioritize emotional content over factual accuracy. Debunking common myths, from vaccine links to detox diets, shows the critical need for evidence-based health practices. Building resilience requires a concerted effort among governments, tech companies, and the public through literacy. True health isn't just about knowing facts, it's about trusting the systems that deliver them.